and welcome to Tell Us Where It Hurts, a conversation around health, well-being, and the many ways people across central Indiana are offering a helping hand. I'm your host, Chris Kirschner, and today's conversation is about racism as a public health crisis.
We would never be afraid to stand up. We're not here to hate one another by any means. This is how unity works. One person had to take the first step. If we both stay silent, nothing gets done. This is our first step.
Now, according to the American Public Health Association, 208 city, state, and county governments across the U.S. have declared racism a public health crisis. And that figure includes, right here in Indianapolis, our own city county council, which declared racism a public health crisis in Marion County on June 8, 2020, following protests triggered by the murder of George Floyd in Minneapolis. So joining me to talk about racism as a public health crisis is Dr. Gina Forrest, an expert in diversity, equity, inclusion, and intercultural competency. She received her Master's of Public Health and PhD in Health Behavior from Indiana University Bloomington, with research focused on health disparities. Thank you so much for being here.
Thank you so much for having me. This is wonderful.
I think with this topic, let's start broad. What do we mean when we say racism is a public health crisis?
Yes. When we think about racism, we think about maybe individual instances that happen as we see, right? Maybe that person walking down the street and someone calling them a name, or something happening, maybe not getting that job. But if we put all of those together, it affects and impacts negatively the lives of our Black and Brown people. And so it is a public health crisis because racism will affect all 8 dimensions of their health, from their social health, emotional health, financial health, physical health. Racism is a piece of that puzzle, and it impacts the health of our Black and Brown communities.
Individually, I can see that, especially from an emotional and mental standpoint. Talk to me about the physical health, what we see as health outcomes. How does it impact those health outcomes?
Sure. So imagine, you have a Black or brown person, and every day they're experiencing microaggressions or things that are said to them on a daily basis, and they have nowhere to turn. These impact their day. That's causing them stress, anxiety, high blood pressure. Maybe that will lead to weight gain, higher cortisol in the body. All of these things compacted together is going to change that person's physical health. Just like we know in our Black and Brown communities, rates of diabetes are higher. Rates of high blood pressure are higher. And we know that some of that is because of the daily microaggressions or racism and discrimination that our Black and Brown people are experiencing every day.
And this is something that's happened over time. Unfortunately, we have a history of that here in the United States.
Yes.
So why now? Why say it's a public health crisis now? Why are these communities coming together?
Sure. I would say that probably most of us in the Black and Brown community, we've said it for years, right? We've known the impact of microaggressions and racism and discrimination and what it's done to our community. But now I think with the recent events that have happened, especially, of course, with the murder of George Floyd, I think what it did was just wake up the rest of the country to say, wow, we really need to look at this. We cannot stay hidden and quiet any longer. We have to look at this from not only the murder of him, and we can look at our criminal justice system, but let's look how that murder is impacting every other structural system that we have, from public health, education, all the systems that we have. We know we have structural racism in all of those. And I think with the protests, with the people just being more involved, more aware, social media, and we know these things that are happening now quicker than we would have maybe 30, 40, 50 years ago. I think all of that now is this storm of we've got to act and we've got to change.
Part of that perfect storm, would you agree, is the pandemic? We've talked about, racism is the pandemic within the pandemic. And I think going through this pandemic over the last year, we've uncovered or peeled back a few more layers. To your point, it's always been there, that systemic racism, but for some reason, this pandemic has really brought it to the forefront.
Yes, the pandemic, goodness sakes. Of course, I'm like probably everyone here. I wish it would go away, but here we are still in it. But yes, we have seen in our Black and brown communities in the United States, what has it done to our Black and brown communities? It's devastated them, not only from more people having the COVID virus, but we can also see now where the Black and brown communities work in those areas that are essential workers. Well, if you're an essential worker, that means you have to be at work or you're going to lose your job. Well, if we're in a pandemic, who's going to watch my children, maybe, if I have it? It's all of this cyclical things that are happening to say, racism is in there, because if you are that person, maybe I am the janitor and I have to be at work. I'm an essential worker, but who's going to watch my children? If I don't go to work, I'm going to lose my job, but I don't have anywhere to take my children. What am I going to do? Well, right there is my financial health is in crisis, but also my emotional health, because now I have to worry and solve this issue right now. That financial health and my emotional health now is going to probably and affect my physical health, because I'm worrying about this. What am I going to do? So all of these little things will add up and impact our health. So if we think about the COVID crisis, from who's working and who's not, who's receiving protective equipment, who's not, who's receiving, who works in the jobs that are more flexible, that maybe you could work from home, and who's not, who has access to daycare and who's not. We know that it's our Black and brown communities even more. And then if we look from a global perspective and leave the United States, look at what's happening globally with the pandemic, the crisis of who will receive the vaccine and who will not. Our poor countries, our poorer countries are Black and brown. So this is a global effect of racism.
You mentioned some of those social determinants, and we've seen them impact, again, the Black and brown communities more so than white over the years. So let's kind of tie these all together. We've talked about each one individually in some of our episodes of this podcast. So when we talk about racism as a public health crisis, I mean, how do these all interact when you talk about housing and transportation and education, and how they're impacting the health, and especially the health of our Black and brown communities?
Sure. We could take at least 8 hours and talk about each one of those dimensions, right? But if we just go back and let's just think of housing for a moment. Think of segregation in housing, and how at one point, there were red line districts to say, nope, only white people can live in this community, Black people can live in this community. Well, right there is an issue. Because if in the white community there are more access to public parks and green space and different buildings, medical institutions, education, right there is going to set that person up for a different life and different outcomes than in the Black and brown community. And then if we move forward, not a lot of that has changed in our current situation, right? A lot of us could think, well, but Gina, that was back in the 30s or the 20s or the 50s. No, it still happens today. We still see that you can cross the street and there is the divide of, oh, this is an affluent community, affluent sometimes meaning white, and non-affluent, meaning our Black and brown communities. And look at the difference that's in the schools. Look at the difference that the access, again, to health care. So just from a housing and our geography will impact our physical health from, again, that access to a sidewalk, maybe exposure to lead-based paint, to green space. That's our environmental health, and then that will impact our physical health, because if I don't have the freedom to think I can go for a safe walk after work, I'm not going to. Or if I live in a crowded place with not as much clean air, I'm not going to maybe want to go for a walk. So now that's impacting my physical health. Well, gosh, that's already 2 of your 8 dimensions that's negatively impacted. And then if we think about our financial health, if it's harder for a Black and brown person to get a job, to receive that callback from an interview, and we know the statistics there, right? Research has been done so much on quote, Black and brown sounding names and not receiving that callback. Even with adding a felony to a white sounding name, those resumes will get a callback before a Black and brown sounding name, quote unquote, without a felony. So right there, if you're not getting the callback, well, that's impacting my financial health, that I can't get the job to maybe move out of that neighborhood to have the better opportunity. So everything is just rolling, right? Everything is connected. We cannot say that our determinants of health are separate, right? We are our health and we are one person. And so what impacts my environmental health is definitely going to impact my emotional health, my financial health. Then think about your spiritual health, right? Some people, when you think of spiritual health, it might be your religion, maybe meditation, whatever it is to connect to that larger being. But if you are maybe depressed, maybe you don't have that free time because you're working 2 or 3 jobs to make ends meet, that's something that's probably going to have to go by the wayside because you might not have the time.
You talked about microaggressions earlier. How do those manifest themselves? I mean, if you're not Black or brown, you don't understand. You don't get it. So help us understand.
Sure. Microaggressions, that term was coined back in 1970 and recoined in 1973 and then again by Dr. Sue in 2007. And it's those, I'll say little things, as we say micro, those little things that people say to one another, and you just don't know if it was intentional or not. If you've ever had that moment when someone said something to you and your first thought is to say, oh, well, thank you. And then right in mid thank you, you think, wait, was that a dig or was that a compliment? So it's those things that people might say. So for me, for example, one example I had was when I returned back to receive my bachelor's degree. I was 29 years old. I had quit school early in my, quote, regular life, right at the 18, and I went back to school at 29, and I was picking up my son from second grade, and a mom came up to me, knew that I was back in school, and she was saying, oh, congratulations, you're back in school. You must be so busy, because she knew I had 2 kids. And I said, yes, I am busy. I don't really know how I'm going to do this. And she said, well, I'm just so glad you're getting your GED. So it's that right there. Can you see how that little moment of, you want to say, well, thank you. But why did she have to throw in GED?
Right.
Why did she assume that I was getting my GED, not my bachelor's or master's or even my PhD? Mm-hmm. She didn't know me that well. So on one hand, you could say, well, she was trying to be nice. But on the other hand, was it a dig? That's that microaggression. It makes you just think for that moment. So if you can imagine, again, why we say micro, because that one incident didn't cause me to go into the hospital. It didn't cause me to have depression or anxiety. But we know that our Black and brown communities and our people who are in the LGBTQ plus community receive those microaggressions every day. And if we could see them maybe as a paper cut on our body, one paper cut would not tell you to say, Gina, you've got to go to the hospital. Of course not. But at the end of the day, if you saw me and I had 30 paper cuts on my arm and I was bleeding, I guarantee you'd say, well, Gina, what happened? And then that would allow me to explain it. But because microaggressions are only between the giver and the receiver, you don't see how much it hurts me at the end of the day. So microaggressions are there, and it's those things that people say. There's 4 types of microaggressions, and one is a micro insult. So the example I just gave was a micro insult. But there's also micro assaults, and those are the ones that are very big and on purpose. That would be, if someone came right out and called me the N-word. You can't deny what you were saying and what you were doing. A microinvalidation is a third type, and that would be when you just deny that someone's experience even exists. So it would be if I told a story and someone said, well, Gina, I've lived here my whole life and I've never seen that happen. Or, Gina, racism, does it even exist anymore? Even though I'm telling you my experience, you're invalidating what I am saying. And then the last one is an environmental microaggression. And if you think about things like when you go into a doctor's office, what are the pictures on the wall? If we went into any doctor's office right now and they're here to serve everyone, do they just have pictures of only white people on the wall, or do they have pictures of everyone? Would I feel comfortable going there? Are they representing people in their 40s like I am, or are they only marketing to 20-year-olds? So there's 4 types of microaggressions, and we experience those on a daily basis. But again, one of them, being micro, probably doesn't impact us. It's the accumulation of all of them throughout your day when we're just trying to go to work and live our life just like anyone else. Mm-hmm. But at the end of the day, if Black and brown people, we're not talking about them, we're not trying to release them from our spirit and our self, what are they doing? They will impact us on a physical and emotional level. And again, going back, it will impact our health.
You referenced an example of microaggression in a doctor's office, and speaking with one of our physicians who happens to be a Black physician, and he mentioned sometimes there's those microaggressions that pop up in the healthcare setting unintentionally, or people aren't aware that they're happening. Someone who's not a person of color, someone who's white, who may label a patient as difficult, he'll deal with the same patient and not find that to be the case because the perception is because they're Black or African American, they're a difficult patient just by virtue of, if they're questioning a certain treatment or because there is a mistrust there among that community, correct, with healthcare.
Yes.
So how do you bridge that divide between, okay, we've got racism issue as a public health crisis, but we also have this mistrust of our healthcare system?
Yes. Trust is huge, right? Even if we just think about our own relationships. If you and I are good friends and I break that trust, what are we going to do to repair it? We both need to talk about it, own it, decide how we're going to repair it. There's so many layers that come into rebuilding that trust. So just like that, we have to do that with our healthcare system and our Black and brown communities. I would love to see our healthcare system admit and own the mistakes that they've made to our Black and brown communities. And then what is the work that they're going to do to put into it to rebuild the trust? I would love to see that every healthcare person, from the person doing the stocking of the rooms to the physician, every person, they have to have training. And I don't mean 1 hour lunch and learn and you're done. This is a training that goes on all the time. It has to be embedded into the work that we do because we all have biases. We know that. We all have implicit or unconscious bias. And in order to work on that, we have to talk about it and make it regular part of our everyday. And it's not something that we stigmatize or punish. We have to talk about it. We have to make it just common everyday speak. And how we can build that trust is by training, but it's training that's ongoing. And so if people understand their unconscious or implicit bias from the get-go, hopefully that would help them be a better practitioner, again, or customer service provider. It doesn't really matter your role, just a better human being here on this earth that we have to, we do talk to and engage with different people that are different than us. So how do we build that trust? Talk about it, we own it, and then we have to be trained in how to improve that relationship. How do we have and learn about implicit bias? How do we train, and how are we learning about civil discourse? How are we learning about the history that's already happened to Black and brown communities from the healthcare perspective? We don't talk about those things. And unfortunately, in our K-12 education, we might not have had that education. And then if we didn't go to college and have that certain college course that might have talked about it, we just don't know about the things that have happened. So for me, again, it goes back to trust, training, education, and hopefully creating an environment where we are open to those dialogues.
Going back then to all these cities and counties, communities that have declared racism a public health crisis, then it's one thing to declare it. It's another thing to do something about it. Yes. So at what point do we hold communities accountable? And what should that accountability be?
Sure. Right. Accountability, think about that again, in your own life. We are all accountable to someone for something. And without that accountability, it's nothing. Right? Why is a program such as Weight Watchers, why is that successful? Because it holds you accountable. For me to go in and weigh myself maybe in front of others, it's holding me accountable. Your checkbook holds you accountable because you're not going in the red. We need that system of accountability. I would love to see accountability buddy in the workplace. If you and I are both on this DEI or diversity, equity, and inclusion journey together, we're holding each other accountable for reading a book and talking about it by speaking up in a committee meeting. We are an accountability to each other. So if we think about all the communities that have started this declaration, like you just mentioned, yes, those are great words, but what does that look like? It looks like talking to Black and brown communities and actually asking them what do they need. It's putting Black and brown community members on the committees and actually having a voice. It's talking to, again, going into the Black and brown communities and seeing what it's like to live there. What's it like for them to go to work? What's it like? You have to talk to the people who are living that experience. They have to have a seat at the table to be able to change the circumstances in which they live, work, and play. Once you have that data and you have their voice, then we can actually build a plan to say, oh, this is what we heard. This is the change that we're going to make. And in 6 months, we're going to make this change. In 1 year, this change. In 3 years, this change. But it's ongoing. You cannot just have a declaration statement and then it's over. We have to now put that plan in place. And again, that looks like people at the table who are Black and brown. I challenge your listeners right now to think of all the committees or groups that you serve on. Okay, once you have that pictured in your mind, that might be 10 or 20 people on this committee. Who are on that committee? Is it people that are representing the people that you're trying to serve? I right now, as an able-bodied person, would not serve on a committee for those with physical disabilities without having someone with a physical disability as a part of that group. I do not know what it's like to live that life. Sure, could I guess? Yes. Could I assume? Yes. Could I be empathetic? Yes. But that's not the same. So can you take an honest look at the committees that you serve on to say, we need someone else here at the table so they can have a voice?
Do you have any concerns that this is just a temporary, this is the cause du jour, if you will, and it won't have any longevity? Or do you feel this is different this time, that there is going to be some sustainability here?
I'm very optimistic. I'm hopeful that this will have some sustainability over time, only because we've had this groundswell from more than one community, that it's not just the community where the incident took place, as in the murder of George Floyd. It's all over the United States has had this feeling. But I think what it's going to take is the people in power And I don't mean power, quote, the president, but power in every situation, that power of who's running this nonprofit, the power who's running this for-profit business. They have to do that hard look around to see who's at my table and how can I improve. And I hope it's people holding each other accountable that will continue to make this change. And for us to move forward, we have to hold each other accountable.
Dr. Gina Forrest, you've been an absolute delight. Thank you so much for your insight, and thanks for all you're doing for our communities.
Thank you so much for having me. I appreciate your time.
I'd like to thank our guests for being part of today's discussion, and thank you for being part of our journey as we all become better listeners. I'm Chris Kirschner, and this has been Tell Us Where It Hurts. Until next time.